Hi, this is Dr. Farley. I want to be going over with you today the Neuro-Biomedicine diagnosis packet. And really what I want to go over with you is how long it took to put this all together so that we have a clear three-step process. Proper testing, as many tests as possible. That's the in-office test here, the Super 7 testing. That's the expanded blood panels. That's the specialty blood panels. That's any other specialty test that we may do. That's outside tests that you may bring in. That could be x-rays, MRIs, CT scans, all the different tests. And then from there, I try to give you a summary of what it is that I found. So I break it down into your medical diagnoses. We don't treat any medical diagnoses. So if you came here for Parkinson's, thyroid, depression, anxiety, bipolar, schizophrenia, PTSD, Alzheimer's, dementia, that's what the medical doc is treating. Then there's the neuromusculoskeletal diagnoses. These are diagnoses that we put down if you have insurance that may be paying for part of your care here. And then lastly, we have the full neurobiomedicine root functional cause diagnoses, which these are areas of dysfunction and dis-ease. Back to the gears again. We're trying to look at which gears are off. And the key to each person is to identify individually each person what is not functioning well inside of them. So there's no protocol here. The protocol is, there is no protocol. What we have to do is it's got to be a specific neurobiomedicine plan aimed at you and your specific required needs. So proper testing, then a proper root functional cause diagnosis, which is this sheet here. And then lastly, the plan. The other thing that we have to understand also is once we set up the plan, there's another major factor that comes into play called time. We could have everything in order, and your body just requires time to do what it needs to do. So you can't build a 5-bedroom house in 4 months. It's not going to happen. No matter how fast you move, that's about a 12-month project. The same thing with your body. Your body is constantly regenerating and turning over. And the more you provide proper physiology and allow it to work, the better turnover you get, the healthier cells you get, and then gradually over time, your health can go up and up and up over time. So you can be aging at a much slower rate because most of the patients that I'm seeing are prematurely aging. So we'll be going over this with you. There's a lot of information on here. It shows you the actual diagnosis and how we came up with it as far as determined by all of our testing in-house and outside of here as well, and other stuff that you brought in. And then, in general, it's just very thorough. So what we're helping you with is the improper physiology, which is listed on here. We're not treating any disease. We leave that up to your medical doc. We don't modify any medication. We leave it up to you and your medical doc. But we go after areas of dysfunction and improper physiology and then set up a very science, evidence-based approach to try to restore that physiology. And then the power that made the body can heal the body to whatever level it possibly can. So thank you and have a great day.